what are some of the imbalances, let's talk about, that we're seeing in most of our patients? We talked about the stress imbalance. We talked about the energy dysregulation imbalance. We talked a little bit about the digestive tract imbalances that we see, you know. I think just to labor on the digestive tract imbalances, you know, we're seeing a lot of fungal overgrowth in practice as well. And you know, mold toxicity and fungal overgrowth is very, very common. And the root causes of that is antibiotic exposure over time. And interestingly, if someone has sugar cravings, it could also be related to fungal overgrowth, because when you have fungal overgrowth, you desire more carbs. And we're seeing a lot of people with fungal nail infections, but actually they've got systemic internal fungal infection. So you can treat the nail, but if you're not treating the internal system, you're not going to make the progress. And when you have these overgrowth of bacteria or fungi or parasites or pathogens, you're taking away energy because your immune system is trying to deal with that. And also you're creating an environment where you can't properly absorb.
Yeah, so we're seeing a chronic, kind of widespread issue of fungal overgrowth. I think it's being harnessed by our modern diets that are high sugar, high in refined carbs, allowing these kind of pathogens, the fungi, to overgrow in our gastrointestinal tracts. And that's essentially then stealing our kind of energy production, creating a systemic inflammatory response within our body, because the fungal kind of overgrowth kind of triggers these immune mediators to be released into the gut immune tract. So the gut in itself contains like 70% of our immune system, and that's kind of then triggering, you know, what we see kind of systemically. So, you know, some people might see it in their skin, in their scalp as dandruff. Some people may see it in their toenails as kind of fungal toenail, but what that's indicating is systemic fungal overgrowth, and I think that's a really big problem. But, you know, again, simple things that we can do dietary-wise.
How do we test for it?
So there's a couple of ways of testing. So we can either do it on a comprehensive stool test analysis, but the thing with fungi is they're very difficult to culture. So you may still have the symptoms, you may still have it there, but it might not be detectable on a stool test. We can also do an organic acids urine test, and you can see certain markers that would be elevated if there were fungal dysbiosis present. And so those are kind of commonly two ways that we can test for fungal overgrowth.
How would we treat it?
So we can consider good probiotics, so a healthy fungal probiotic like Saccharomyces boulardii, also antifungal kind of herbal antimicrobials. So we've got a good range of different herbal antimicrobials that are really effective at treating fungal overgrowth, but also treating parasites and bacterial overgrowth as well if present. And then also thinking about prescription medications. You know, at the end of the day, we're still doctors, we're GPs, we can prescribe if needed. And, you know, we can think about oral antifungal treatment if needed, and like nystatin is very safe to use. It's not absorbed systemically, so it's really good to help treat fungal overgrowth in the gut, essentially.
Over and above that, ozone therapy as well. You know, so I love using intravenous ozone therapy in practice here in the clinic. I recommend that for my patients now. We're doing it annually, as you know, as part of the annual detox, and it supports detoxification, but also it's really powerful for removing and killing any lower grade bacteria, parasites, pathogens that may be in your bloodstream as well. So I find that really, really effective as well. We talk about the power of mushrooms. You know, mushrooms is growing in terms of its popularity, both from a functional perspective, functional mushrooms, but then also from a kind of mental health perspective as well. If you have functional mushrooms, lion's manes, cordyceps, would that increase if you've got an underlying fungal overgrowth? Do you know anything about the relationship there?
Yeah, so that's a very tricky situation. So some patients with fungal overgrowth may actually notice that medicine, mushroom, mycotherapy can exacerbate symptoms.
It can worsen symptoms.
It can exacerbate symptoms in some people, but in other people, it can work fantastically well because, again, it outcompetes some of the fungal elements that are overgrowing. So there are some fantastic medicinal mushrooms available now, you know, kind of ranging from ones that support your immune system to your stress levels, your mental health. I think it's with anything in kind of holistic medicine or even traditional medicine, you've got to try it to see how it's going to affect your body and see what the results are after trying it. But, you know, I wouldn't be averse to using them for sure because they do have some fantastic properties.